Think you are a reason behind someone's smile. Isn't it always special? Yeah. As a BDS doctor, you can do that and make it possible. Today, we will see what are the pros and cons of BDS, that is, positive and negative sides of BDS, from the opinions which we get from students or those who are teaching the BDS students. Okay, basically, this video is not insisting you to do BDS. First of all, whenever you want to become a doctor, there are many students, okay, who are thinking MBBS is the only way to become doctor. They are not even considering Ayush as an option, even BDS as an option. So, as medical student, if you want to emerge, first you should have a thought. Even BDS and Ayush will lead you to a doctor. I know I'm not compelling you to take this course, but take it in your mind, those are also equal to doctor. Actually, they are for doctors only. Okay, so today we will see why you should think of doing the BDS. Okay, I will give you the pros and cons because it is not your fault also. Just now you have completed the 12th and you have already in your mind that you want to do MBBS and you are unable to switch into any other option. So if you get to know what are the things difference between MBBS and BDS, you may think of doing that or even you can reject. So we will quickly start. First one is a quick intro. What does BDS stands for? It is basically your Bachelor of Dental Surgery, right? And it is your specialized undergraduate degree and on dental health, right? It is mainly take care of your oral health, and it is always valid in India and even in many other countries. They are earning much more than in India. It is a 5 years course. Okay, it is a 5 years course. 4 years you will be studying and 1 year you will be having an internship as like as your MBBS. See, and the main courses you will be focusing will be like your human anatomy. The main difference, okay, even every BDS students used to say we also learn same as MBBS students only, but the only difference in the human anatomy we give much more importance to the face, okay, only your oral structure other than the other parts of your body. Okay, you will have the physiology, biochemistry, dental material, dental pharmacology, okay, so many things related to your dental. Now, coming to the quick intro of your studies. So, what are the subjects I'm going to deal with if I'm taking BDS? Okay, these are not like exact. This I got from for a sample. Okay, one or two might differ, but this gives you an overview of how we are going to study. How BDS is also somewhat equal to your MBBS. Okay, if you have a look at these courses, you will get an idea. Firstly, if you see, we are dealing with the general human anatomy. Okay, which include your embryology and even your histology and general human physiology, biochemistry. Then you will start dealing with your dental anatomy, okay, and oral histology. See, initially you are having a general human anatomy and embryology and histology. Then, apart from that, you will be giving some specialized studies on your dental anatomy, embryology, and oral histology. Then, dental materials, preclinical prosthodontics, and crown and bridge. Okay, before you starting into the clinical works, you will get to know, right, what are the things you have to do. Those will also be started in your first year itself, and if you see in second year also, there are so many things related to your clinical works. Third year and fourth year, okay, these are the things you are going to deal with your 4 years. Then coming to, there is a intro, okay, I'm sorry, there are internship. So this is a quick intro about your CRI. What is CRI? Compulsory rotatory internship. Okay, you will be doing a internship for 1 year. Okay, it is compulsory for all the BDS students, and in this 1 year you will be dealing with different cases. Okay, this is also another such example how we are going to deal with your internship in full 1 year. If you see, let's say in oral medicine and radiology, you will be posted for 1 month. Okay, and coming to next, oral and maxillofacial surgery, you will be having the cases related to it for 1.5 months. Similar way, in each and every hospital there is a practice how you need to perform an internship. It is not basically like a in oral medicine and radiology alone you can't be there for 1 year, as like right, MBBS how we deal with a different department, same goes for your BDS only. That's what I wanted to mention. You see how they are splitting the month and days. Okay, this is about your internship. So basically, what is BDS, what are the studies, I mean subjects it's going to deal with, how the internship will be. Now we will see pros and cons. At last I have three pro tips for you. So please listen to this video to know that. So for the first pro is course fees. Obviously, if you people know, the BDS fees is always lesser than your MBBS fees, right? And even in your cons I will mention the course fee, so just listen to that and get to know why I mentioned it, both pros and cons. Okay, and so this is one main pro, that is your BDS fees is less than your MBBS fees, or leave off even if you're taking some general management direct private seat. You know, this is one example I got it from a official college website. If you see for BDS, see the annual fees, and for MBBS, see the annual fees. Okay, this is hard what you will be paying in a private. So this is one such option. If you like to do BDS, this is all, your course fee is very less as compared to MBBS. Okay, but I'm not saying you to choose MBBS, just the course fee, sorry, BDS, just the course fee is less. I'm just giving you the insights. Next, course duration. As you know, for BDS it is 5 years, for MBBS it is 5.5 years. So yeah, there is 6 month delay in completing your MBBS, so that is also can be considered as your pro, but still you have 1 year compulsory internship as we discussed. Now, easier admission procedure. I know nowadays BDS is also getting very harder to get the seat, but if you see, even nowadays people after getting like 600, they are thinking whether I'm able to get a government seat or not. But in case of BDS it is less. Okay, if you get something 600 like that, yeah, for sure you can get some government seat, right? So that is what, comparing to MBBS, you know, the BDS uh, competition is less, so the admission procedure will be easier for you if you are choosing for BDS. Now, specialized course. Basically, MBBS is a general course. As you all know, we will be dealing with the whole human anatomy. And if you want to do specifically something, you will do MDMS based on your interest. But in case of BDS, even though it is general, if you know, right, we are completely caring about your dental health. It is also becoming like one of specialization. So with that, even if you're not doing a MD, if you go for a diploma as a add on for your BDS, it will also help you to gain many knowledge also, as well as gain good amount of earning. Got it right? Why I'm saying it as a specialization. And also, if you know, nowadays BDS students are preferring doing MBA from IIMs, that is the top college for MBA. Okay, so this is another pro. Now let's say the main reason people used to avoid MBBS might be the hectic life schedule. Anytime if they call for an emergency, you need to go, you will go. There is no option to deny, right? But in case of BDS, that is there, if you become a dental surgeon, there is a less, very less case that you will be facing an emergency, right? And it is up to you. If you want to see the patient now, you can see, you can book a, they can book a appointment and come and go. Like, it is not like full day you have to be work in the hospital. And mainly the hectic comparing to BDS and MBBS, it will be less hectic. Okay, you no need to work overtime also. Then the another pro is, you might be experienced, you might be having a sweet tooth, and you might have visited to any dentist, right? So just for a root canal treatment, say how much you might have paid. Many of you have experienced, at least your siblings, mother, father, anyone, right? Just for a root canal treatment nowadays a minimum of 5,000 needed. Minimum I'm saying, right? So if you see 5 patients per day, just 5 patients per day, how will you earn for a single day? 5,000 into 5. Think, right? You might not be able to get it very immediately, but think, if you are getting an experience, just be consistent and give a valuable service to your patients, right? That will help you to get more patient. One will promote to the other. And after that, if you have a good number of patient, you no need to work all day, right? Just 5 patient per day, and if you are giving a good quality service, people are willing to pay you more. This root canal treatment leave, there are many treatment, right? There are people who want to remove the whole complete set of teeth, and they will be having the new set of teeth which will be given by you. So there are so many things nowadays people are facing, and now it is an option to make their face look more prominent than the earlier. Everyone should love themselves, that is agree, but now they have option to change if they don't like something, right? So you will be a opinion to do those things. Yeah, you can be earning more in less time, so that is one of your pro. Now we will see what are the negative sides. Okay, lesser government scope comparing to mbbs. In your bds you will be having a lesser government scope. Still, I'm not saying there is no government scope. There is a scope in army, there is a scope in navy. Okay, see, in a short, I think SCC's short service scheme is what is that? I forgot the full form. I'm really sorry. That is giving you the government exam in to become a dentist in your army. Okay, so people who might want to join army, now this is a way to join army, but the scope is less comparing to mbbs. Okay, that is what I make you to understand here. Now saturation point, there are many bds students. Okay, this will go for mbbs also, because the same dialogue people used to say. Nowadays many doctors are there, particularly in india, we will say, right? It is even for bds or even for mbbs. So if you learn the things properly, you can shine wherever you are. Okay, so that is one point here. Now, the materials in the course study of your bds in the 4 years, from the starting of first year, there are many materials that you need to be buying. Okay, which might cost an average of 60K apart from the normal fees that we are paying. This is like given from the students, okay, who are doing bds. This information we have collected. So this is one of your cons, because you are spending more, right? But this instrument or materials which you're buying starting from your first year, if you keep it properly, this can be useful still your pg, or even in your clinic you can use those equipments. Okay, so this become a con as well as a pro. This is kind of investment. Okay, we are doing it in your first year or second year itself, and we are having it throughout our pg or clinic. Now the next con, that is your fees. You might be noticing in pros also I mentioned fees, right? But what I said, mbbs seat, comparing to mbbs fees, bds is lesser. But if you think in private seat, leave the management quota, government quota, private seat which you are voluntarily going and joining, right? In that, in some college they are having 45 lakhs. Yeah, 45 lakhs for your bds as well. So what people are thinking, if I'm giving 45 lakhs for bds, I can go study MBBS in abroad, right? There are many abroad colleges where we can study MBBS for 45 lakhs. So this is where the clash is happening. If you're going for a government seat or in private college of you, if you're going through management quota, the fees is okay, you can do. But if it is through a pure private seat, it is costing a lot. Okay. Now, high management cost. So basically once you complete your bds, and if you, even if you're doing your pg, after that if you want to start up a clinic, okay, for doctors, wherever you have visited the dentist, there are many equipments or instrument, right? Big thing. Even if they just want to check our single teeth, we need to lie on that equipment. So there are big equipments needed, right? So for that, if you want to start own clinic, a minimum of 3 to 4 lakh is expected. Okay, so it is a high management cost, because the equipments will always cost a lot, and obviously a minimum of 3 to 4 lakhs is expected if you want to start a clinic just for buying those instrument. Okay, so this is one drawback we can say. Now, limited option. What does this limited option here means? BDS, it is mainly dealing with our oral health, but MBBS, it is like full human anatomy you are going to deal with. So, whatever specialization you want, there are n number of option will be there in a MBBS. But in BDS, as you know, it is less, but still it is worth it. But comparing to BDS, we have very limited option here. BDS after your UG. Now, these are the add ons which I am going to say. Yeah, bringing a smile on someone's face. It is always special to do that, right? And now, people who are having not the aligned teeth, okay, and if they are having improper teeth or tooth decay, even they will feel like they not feel comfortable to smile, right? When they go to dentist, when the dentist made their teeth proper aligned like others, now they give a bright smile once the teeth is fixed. Okay, you might have noticed many dentists might have kept the picture like before after. Okay, so they will start smiling, like they will feel confidence. Okay, because our face, our teeth is the most important part, one will look immediately, like, right? So you will be a reason to give that smile. Okay, so that is also a pure thing. Now, see, you might be knowing cosmetic surgery, and many stars nowadays opting for that because they want to do some changes for their body. They think that might suit them. Okay, and if you see, I'm just giving you the rate how much the cosmetic surgery it is for a single. Okay, single cosmetic surgery. Say if they are coming for a breast augmentation, it might cost for 2 lakhs. Okay, if you do breast augmentation for a single person, you will be earning a 2 lakhs. Okay, and once you complete the BDS at the time, these amount might be doubled also. Who knows? Okay, so think in BDS there are so many ways to learn, earn a lot, but in MBBS also people do. Today we will just see how we uh, earn a lot in your BDS. Okay, this cosmetic surgery, once you do your UG, right, after that you need to do some specialization for this to do these cosmetic surgery, or you might be knowing, right, plastic surgery. Yeah, okay, let's say facelift or thigh lift, lip augmentation, lip reduction. People who are having a black lip, no, they want to make it as a pink. For that also you can learn from 25,000 to 40,000 for single person. Just you need to spend 1 hour or 2 hour max. Okay, so these are also in high demanding. It is not like BDS students only just see what is the problem in your teeth and do some root canal treatment and they will leave. It is not like that. There are so many options. That's what I want to say to you. And see, the most important, you will be able to save one life from cancer. Yeah, even BDS student can become a person who is saving your patient from cancer. Okay, how? See, now I'm giving you some data from the internet. How much is the rate of oral cancer in our India? You can see, right? It is like 30% of all cancer. We do have this oral cancer. So once you become, yeah, dentist, that is one, after completing your BDS you will do some PG, and then you can do oncology for your oral health. Okay, and you will be a reason to save one's life. So don't limit BDS as just checking the teeth. Okay, if there is a problem, we do have prawns and crowns, and it is there in every course. It is not just for medical field, engineering, arts, whatever course you do. But see, like you're becoming a reason for someone's smile. See the cosmetic surgery, you can change someone's view. You're saving someone life from cancer. So think, these are also there in BDS. That's what I wanted to convey. So think of these option also. If you want, you can join BDS. Okay, and if you want this PDF, join in the Telegram. And if you want me to put any video based on Ayush or something, let me know in the comments. See you.